Of course, orbit is a part of the face, so
Yeah.
it is a part of the facial structures. But as eye surgeons, we know about the intricacies around
Yeah.
the eye, how
Yeah.
important.
So we don't have to actually open a skull.
So that is why we decided to take up this topic, because orbit is so important. It's a place where the eyeball is resting with so many important structures around it.
As a trained orbital surgeon, we believe that things of the eyeball and the orbit can be dealt very sensitively and carefully by an orbit surgeon.
Our orbit surgeries are absolutely minimally invasive.
Exactly,
You will not even get to know that a tumor the size of an eyeball has been removed.
One of the reasons that we want to raise this awareness, let me be very blunt here, I'm transparent, I'm blunt. Hi, hello everyone. Welcome to iTalk, yet another brand new episode. I'm Dr. Fairooz.
I am Dr. Shaifali.
And we are oculoplastic surgeon and an orbit surgeon. Today, we are here to talk about yet another interesting topic that we deal with as surgeons, and that is orbital surgeries. So, what is orbit?
So orbit is the bony area around the eye where the eyeball rests. It has bone, as I said, it's like the bony window. And around the eyeball, to give it cushion, there is fat. We have important nerves. We have eye muscles. So all of these are the soft tissues which are around the eyeball, and that makes up for the bony orbit.
So orbit is this space, the bony space, where you have the eyeball, just, kind of concluding what Dr. Shaifali said. And the eyeball has muscles, and the eyeball is cushioned in the fat. And we have nerves, we have vessels, and these structures in the orbit are so crucial for the eyeball, for the existence of the eyeball, for the movement of the eyeball, for the vision itself. If the major circuit, the nerve is damaged, or the bony socket is damaged, if the muscles are damaged, even if you have a good eyeball, the structures of the eyeball, it can affect your vision, it can affect the movement of your eyeball, and there are various diseases starting from infection, inflammation, to tumors, to cancers, to trauma that can affect the orbit. And why we chose this topic today is because there is very little information out there. When we have these patients walking in with orbital tumors, orbital trauma, they hardly barely know which specialist they should go to, very basic, and it's so easy. Orbital surgeons deal with orbital problems. And that's why we thought, we should raise this awareness today and get some information out there.
And as we also discuss, of course, orbit is a part of the face.
Yeah.
So it is a part of the facial structures. But as eye surgeons, we know about the intricacies around the eye, how important the nerves, the muscles, the areas around the eye are, how important it is to preserve those structures.
Yes.
And not be too aggressive around this area.
Yeah.
I think that knowledge comes from the basic knowledge of ophthalmology, that is eye surgery.
Yes.
And I think that's why orbit surgeries being part of ophthalmology is so important.
Yeah. So why Dr. Shaifali is saying that is, one of the reasons that we want to raise this awareness. Let me be very blunt here, I'm transparent, I'm blunt. There are other structures in and around the orbit, that is the sinus. Then you have the brain. So there are three people dealing with, structures in the face. One, the eyes, the orbit is definitely oculoplasty and orbit surgeon. But we have a neurosurgeon which is sitting, close to the orbit. We have the ENT doctors who deals with the sinuses, and we also have maxillofacial surgeons who deals with, other bones of the face. But then we believe, because sometimes the patient has a confusion, where do they go for orbital surgeries? As a trained orbital surgeon, we believe that things of the eyeball and the orbit can be dealt very sensitively and carefully by an orbit surgeon, because for us going inside the orbit and coming out is actually a jiffy. because we know where the nerves are, where the important nerves are, how the muscles are attached, and how the entire structure is, and that's what we have been trained for.
And I think it's the time for minimally invasive surgeries.
Yeah.
So actually, our orbit surgeries are absolutely minimally invasive. You will not even get to know that a tumor the size of an eyeball has been removed with just a small incision or a scar.
Yeah, so we don't have to actually open a skull or a scalp to get inside the orbit. As an orbital surgeon, things have so smoothly evolved over the past many years with various surgical techniques and equipments, where, as Shaifali said, we call it minimally invasive orbital surgeries. We make small openings, small incisions, hidden incisions. We actually approach the orbit from inside very carefully, because we know what the structures are there. Go and take a large tumor out. We can go through the eyelid with a very cosmetically hidden openings, small openings from in different angles. It could be in the corner, upper corner, lower corner, and that is how orbital surgeries have evolved. Now, when we talk about orbital surgeries, what are the major situation that we do orbital surgeries?
So as I said, that there is a bone around the eye. So of course, if you are into an accident, unfortunately, or any other trauma, blunt trauma, even like a fist coming and hitting your eye, it can lead to fractures like in any other bone. So fractures of the orbit, of the orbital bones, are what are dealt with in orbital surgeries.
One of the things we deal
yes.
in orbital surgeries. Yeah. So when a fracture happens, the eyeball can just sink, because eyeball is held in position with tissues which is inside the bony cavity, and then the patient can have sunken eyeball. They can have double vision. The muscles can be entrapped. So we sensitively deal with the muscles. We place implant in the orbit, and that is how we deal with orbital trauma. And we, being eye tumor and eye cancer specialist, we deal with a lot of orbit where tumor can grow in the orbit. When a tumor grows inside the orbit, in this space, what happens is that the tumor pushes the eyeball. So the patients can come with bulgy eyeball, where again it can also go and compress vital structures like the major nerve of the eye, which we call the optic nerve, or the muscles, causing damage to vision, and so forth. So we have to carefully go and remove that tumor. So that is another orbital surgery that we do as an orbit surgeon. Then there can be situations like thyroid.
Thyroid is a very common systemic problem, and not many people know that thyroid affects the eye.
Abnormal
status can affect the eye, even like a hyperthyroid or hypothyroid, and sometimes even with normal thyroid values, like things that we call euthyroid. When we tell patients that have you had your eyes checked, because you have been a thyroid patient for such a long time, they have no awareness about that thyroid can affect the eyes. There can be inflammation in the eye. There can be bulging of the eye, something that we call as proptosis. The muscles get thickened, the fat around the eye gets swollen up. So these are the situations in which we have to do. Sometimes it can be taken care of by medicines like steroids, but when it is too much of a proptosis, orbit surgeries needs to be done, decompression needs to be done to put back the eye in the socket, because it's so bulgy that it is exposed, and of course it is not healthy for that eye to be exposed, and then we have to put it back inside. The nerve is stretched. These are the situations in which thyroid eye disease might require an orbit surgery, where we deal with the fat, we take out the fat, we deal with the bones around the eye, we trim them to create space so that the eye can actually go back inside. These are the situations in which orbit surgery might have to be done.
Yeah, and certain bad infections. So recently I had seen a child in Kerala where it was a worm infection. The child has had a bulgy eye and sitting for a long time, not going away with drugs. We tried tablets, etc., etc. Finally had to go inside, and this was a 2-year-old child, where we had to go inside. I had to go inside, take the worm out of the eye. It was a dirophilariasis, which is a worm infection of the eye. So there are various situations in the orbit which usually presents as bulging of the eyeball, puffiness of the eyeball, where the right place to land up is with an oculoplastic specialist who deals with orbit surgeon. Not all oculoplastic surgeons deal with orbit surgeon, but there are very specific orbit surgeon, and there are many, so those are the right people that you have to find whenever you have an orbit issue, a bulgy eyeball or double vision or something which is very puffy going on in the eye. And that is what we wanted to highlight today regarding orbital surgeries, because it's never spoken. There is not much of information out there regarding the same.
And that is why we wanted to deal with this topic today and give you as much information that we could provide in the limited time we have. Definitely, if you want to contact us, we will be leaving our contact number here for any eye-related issues, not just this, any eye-related issues. We are always here, just a call away or just a message away, so you can always contact us.
Thank you so much for listening to us. See you soon.
See you. Thank you.
Thank you.